Truth bomb time. I think most people come into labor and delivery not planning on an epidural, but then in most places, although not all of them, most people end up getting the epidural. So what happens between the time they go into labor until they request the epidural, and how can you avoid those things if you're really wanting to try for an unmedicated birth? Today, I want to share 5 reasons why people end up getting the epidural in the hospital. And I know a lot of you are going to say it's the nurses pushing them to get the epidural, but I'm here to say I honestly don't care if you get an epidural or not. And I think most labor and delivery nurses feel that way too. I will say in the hospital, we are required to ask you about your pain at every assessment. Now, we're also supposed to ask you about your pain every half an hour, but you can say, hey, I don't want to be asked about my pain again, and your nurse should be good to do that. But at assessments, it's really important that we ask you how you're managing your pain and how you're coping with things. And if you're interested in a video about coping versus managing your pain, I have a video about that. I'll put it down below. I'm also here to remind you that the epidural is not the only thing that you can use for pain management in labor and delivery. I have a freebie that talks about the 4 ways that you can manage your pain in the hospital. I'll link it down below. The first reason that most people end up getting the epidural in the hospital is that they are exhausted. I think a lot of people plan to manage the pain and they have ways to work through that, but that gets really hard when you have not had any sleep at all. I think you and I both know this feeling. When you are exhausted, are you nice to people? Are you able to manage stressful situations as well? No, and that same thing goes in the hospital as well. And honestly, I think this is smart. You have to remember that once you get to 10 centimeters, on your first baby, on average, you have about 2 hours of pushing ahead of you. So if you're already exhausted and you're 6 centimeters, get the epidural, get some rest. That's part of the reason that it's there, is to help you fill up your gas tank so that you're ready to push out the baby and enjoy the baby once the baby's here. Now, a pro tip I have is that far too many people start staying awake because they're having contractions, thinking that if they fall asleep, either they'll miss the baby coming out or the contractions will go away. 2 things. First off, when labor is getting enough that you should head into the hospital, it is not something that you can normally sleep through. So if you can sleep, I think it's a huge win. Also, if your contractions were going to stop while you sleep, they were going to stop anyway, so you might as well get the rest. I encourage people to ignore contractions as long as they can. You know, partners might want a time, but you as the pregnant person, I say ignore it and try and get some rest. Once contractions get closer than 5 minutes apart, that might be a time to start timing them. And again, it's a great job for your partner. So prioritizing rest when you're in early labor can be a big win in remaining unmedicated in the hospital. And a lot of people don't do it. Okay, the second reason why I see a lot of people end up getting the epidural is that they get induced. I always feel hesitant when people have a strong inclination to have a natural birth, but also make the choice to be induced. Now, sometimes that's not really your choice. Your blood pressure is too high. The baby isn't growing right. There's other complications. Of course, having an induction is always your choice. I have a ton of videos on that in here, but sometimes your hand is sort of forced, and I totally understand that. But there's a lot of people who want to just stop being pregnant and they make the choice to be induced, but they also don't want to have an epidural, and a lot of times those 2 things are not compatible. Inductions are longer. You have to remain on the monitor during an induction. It is a requirement of us running the induction. I know people online will say that you can refuse anything, but if you refuse fetal monitoring, we have to stop the induction, because I, as a nurse, could lose my license if I was running those medications without the baby being on the monitor. In some hospitals, they have wireless monitoring that you can use to still walk around the facility. I have a whole video on wired versus wireless monitoring that you guys are going to want to check out, because I don't think you all understand that wireless monitoring is not the wizard that we all wish that it was. The hospital is a horrible place to sleep. See the one above this about being exhausted. A lot of times that happens with an induction. Pro tip, you can ask for a sleeping pill if you're just having early contractions in the hospital. And I think it can be a big help. I always tried to get an order for a sleeping pill from providers before the night hit, so that if my patient was having a hard time sleeping, we could give them a little something so they could try and get some rest. And at the hospital, you don't have your things, your smells, your people. You're just not as comfortable. So an induction can make it really hard to not end up getting the epidural. And if you're choosing to be induced, I think that's something that is really important to be aware of. Now, a lot of this depends on how long your induction, what your cervix looks like. I actually have a whole video on if you are ready to be induced, and I'll put that down below as well for people who are looking about induction. And I have a whole induction checklist that I link to. This is actually a whole post on my website, so you can find all of those links and things inside the post, which I'll put the post link down below as well. And in that post, I actually have a birth story of someone who made it through an induction without an epidural, and it might help you to understand what she did so that you can think about what you can do if you are getting induced. The next reason I see people get an unplanned epidural is that they come into the hospital too early. Now, this isn't something that a lot of people talk about, but it is well known that the best place for most people in early labor is to be at home. Once you come into the hospital, it's sort of the watched pot theory that the watched pot will never boil, the watched pot will never go into labor. And while that's not entirely true, a lot of times the longer we watch you, the more problems we can find, at which point we feel like we need to find solutions, which can be interventions. So when you can labor at home, I think it's best to labor at home. Now, this can be really scary, especially for partners. My husband did not like to labor at home at all. I think a lot of partners are thinking, we're paying for the hospital to manage your labor. Why don't we go in and let them manage your labor instead of feeling nervous about doing it at home? It's really important that you get your partner on board with laboring at home for a little bit. In the online prenatal class for couples, we actually have a whole video that we talk about early labor, what you can be doing at home to help labor progress, what your partner can be doing to assist you, because they are really your biggest helper when you're at home, and when you should head in the hospital and how to have that conversation with your provider, because I am here to tell you that it's different for everybody, because I know a lot of you guys live an awfully long way away from your hospital. Getting a class that prepares both of you is such a win. I'll put the link for that down below. Now, another pro tip in this is to use your provider. Most providers have somebody that's on for them 24/7. So you call into their answering service, or they tell you to call labor and delivery and they're able to triage phone calls. I gotta say, as a labor nurse, by year 5, I could tell on the phone if you were ready to come into the hospital or if it would be better if you hung out at home. So don't forget to use your provider or whoever they have on to triage things for you. I think it'll be really helpful. The next reason that I see people get an unplanned epidural is that they simply did not prepare. I see so often people saying, well, I have a really high pain tolerance, so I should be fine in labor. And I am here to tell you that I don't really agree with the whole pain tolerance thing. You got to remember, I worked pediatrics, I worked geriatrics, I worked hospice. I've seen people through a lot of different types of pain. And I got to say that labor pain is very different than other types of pain. So just because you've been able to manage cramps or like a broken arm really well doesn't always mean that you're going to be able to manage the pain in labor and delivery as well. This is why I really recommend that absolutely everyone get prepared with some natural pain management techniques. Like I said before, I encourage you to stay home while you're at early labor, and that is going to require some natural pain management techniques. Otherwise, you're going to be coming into the hospital wanting the epidural and possibly too early. Now, I'm not saying that you need a full degree in natural pain management techniques, but I am saying that you need to practice the techniques that you have at home with your partner to really help them work effectively for you. The online prenatal class for couples has not only a natural pain management video, but it also has the hospital interventions that they can give you for pain as well. I think it is 100% important for people to know both about natural pain management and what the hospital offers, because I don't want you guys scared of the epidural needlessly. I know a lot of people online talk about it and don't really know what they're saying, so make sure that you get prepared with an expert. These types of things that you can use to prepare is different techniques like massage or pressure or natural breathing techniques, and all of those are included in the online prenatal class for couples. Again, I'll put the link for that down below. And honestly, the last reason that people get an unplanned epidural is that it is there. I sometimes see studies that say people who have a birth center birth are less likely to have an epidural. And I'm like, obviously, because they don't offer epidurals at a birth center. When you are in pain, it is okay to tap out and say, this isn't working for me anymore. I would like to get the epidural. Most people's insurance covers it. It has been proven to be safe for people in labor. Of course, there are risks, as there are risks with anything, but most epidurals, the vast majority, are done without issue, and people are really happy that they got them. I know a lot of people online are not going to say that, but I, having seen thousands of epidurals, can say that to you confidently. So if you get into the hospital, you weren't planning on an epidural, but things are just getting to be too much. You're too tired, the pain is overwhelming you, and you're not coping well, get the epidural. It's an option at the hospital, and I think it's so great. We deserve options like that. And if you're sitting there thinking, Hillary, I am so scared of the epidural, in the online prenatal class for couples, we actually have a video where I walk you through the epidural process using basically home supplies and a Raggedy Ann doll so that I can explain it to you without it being really scary. If you're looking for more information about epidurals, I actually have an epidural frequently asked question video that I'm going to put up here. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.